So you've probably heard of doxycycline, right? It's one of those go-to workhorse antibiotics. It's been around for decades. Doctors prescribe it for everything from a nasty chest infection to acne. But what if I told you that its most fascinating roles today have almost nothing to do with killing bacteria? Yeah, this common little pill is hiding some incredible secrets.
We're about to dive into how this medicine cabinet staple, a drug from the 1960s, is being repurposed in some seriously cutting-edge ways. I mean, from calming down chronic inflammation to acting as a modern-day shield against infection. This is the story of an old drug with some very new tricks.
All right, here's our game plan. We'll start with its classic job as an antibiotic, then we'll uncover its surprising second life as an anti-inflammatory. After that, we'll check out its new gig in prevention, and finally, we'll cover the essential rules of the road for using it safely.
First things first, let's get grounded in what doxycycline was born to do. As a broad-spectrum antibiotic, its original mission was dead simple: stop bacterial infections in their tracks. This is the doxycycline that you probably already know.
The way it works is actually pretty clever. Think of a bacterial cell as this tiny factory that's constantly making proteins to grow and multiply. Doxycycline basically sneaks inside, finds the protein assembly line, and just jams it. It latches onto a key piece of the machinery, and boom, production grinds to a halt. The bacteria can't grow, they can't multiply, and that gives your own immune system the perfect chance to move in and clear them out.
Now, when it's used for something like acne, doxycycline is often compared to its close cousin, minocycline. Both work, but they come with different trade-offs. The big watch-out with doxycycline is photosensitivity. It can make you get a sunburn way more easily. Seriously. Minocycline, on the other hand, is more known for causing dizziness and vertigo, and it carries a rare but more serious risk of autoimmune reactions. So you can see why a doctor has to weigh these things, based on a patient's lifestyle and history.
Okay, so here's where the story takes a huge turn. This is the big plot twist. Beyond its life as a bacteria fighter, doxycycline has this powerful secret identity. It's an expert at calming inflammation. And this is the secret that has made it a major player in a whole new set of diseases.
And here is the crucial point. This happens at doses so low, they don't even act as an antibiotic. This is called a sub-antimicrobial dose. So it's not messing with your gut bacteria, it's working on a completely different pathway. It's basically telling the body's overactive alarm system to just quiet down by dialing back all that inflammation.
And this shift in thinking opens up a really fascinating range of uses. It's a frontline treatment for the inflammation in rosacea and severe acne. For dry eye that's caused by a certain gland dysfunction, it helps unblock oil glands by reducing inflammation. And even more exciting, researchers are now looking into its potential to manage inflammation in rheumatoid arthritis and even in the brain, to help with complications of Parkinson's disease.
To see this in practice, just take a look at a simplified treatment guideline for rosacea. Right there, as a first-line oral therapy, you see it: low-dose doxycycline. And again, this isn't to kill bacteria on the skin, it's there specifically to control the underlying inflammation that's causing the flare-up.
And this points to an even more surprising future. A study in 2022 highlighted its potential in neurology. For people with Parkinson's, a common treatment can cause a major complication called dyskinesia. These are uncontrollable, involuntary movements. The idea that this old antibiotic could help with that by reducing inflammation in the brain, well, that's a potential game changer.
And here's the data that got researchers so excited. In the model with Parkinson's symptoms, you see this massive spike in these brain signals that are just screaming inflammation. But then look at that third bar. When they added doxycycline to the mix, those inflammatory signals dropped dramatically, getting much closer back to normal. You can literally see doxycycline taming that fire in the brain.
So it can treat active infections, and it can treat inflammation. But what about preventing problems before they even start? This is doxycycline's newest role, acting as a modern prophylactic shield.
One of the most talked about new uses is DoxyPEP. That stands for doxycycline post-exposure prophylaxis, and it represents a major new strategy in preventing certain sexually transmitted infections.
The crucial thing here is all about timing. DoxyPEP is not something you take every day. It's a single dose taken after a potential exposure, and it has to be within this critical 72-hour window to be effective. The clock is ticking. So let's just run through the fast facts. It's a single 200 milligram dose taken within 3 days of unprotected sex. And the studies are showing it can significantly reduce the risk of getting bacterial STIs, specifically syphilis and chlamydia. Based on the current evidence, the CDC is recommending it for specific high-risk groups, like gay and bisexual men and transgender women who've had an STI in the past year.
Of course, its role in prevention isn't totally new. For years, it's been a reliable option for travelers to prevent malaria. But there's a key practical detail you have to know. Compared to another common option, Malarone, the post-travel routine for doxycycline is much longer. You have to keep taking it daily for 4 full weeks after you leave the risk area versus just 1 week for Malarone. That's a big difference.
Finally, let's cover the Essential User's Guide, because like any powerful tool, doxycycline has some important rules of the road to make sure it works well and keeps you safe.
The good news is, the most common side effects are pretty easy to prevent. To avoid irritation in your throat and stomach, you have to take the pill with a full glass of water and stay upright for at least half an hour. No lying down right after. If it makes you feel nauseous, you can try taking it with some food, just not dairy. And because of that photosensitivity we mentioned, a good broad-spectrum sunscreen is absolutely non-negotiable.
Here's another critical rule, and it's all about timing. Doxycycline binds to minerals like calcium, iron, and magnesium. If you take them too close together, the drug just won't get absorbed properly. You could lose up to 40% of its effectiveness. So, the solution is the 2-hour rule. Leave a 2-hour gap on either side of your doxycycline dose before taking any mineral supplements, antacids, or even having a glass of milk.
And finally, let's be really clear. There are some people who should not take doxycycline at all. It's contraindicated during pregnancy and for kids under 8 years old. The reason is that it can bind to the calcium in developing bones and teeth, which can lead to permanent tooth staining and could potentially affect bone growth. This is a hard and fast rule with very few exceptions.
So, from an old-school antibiotic to a sophisticated anti-inflammatory and a modern prophylactic shield, doxycycline is a master of reinvention. It really makes you wonder, doesn't it? What other familiar, time-tested medicines are sitting on our pharmacy shelves right now, just waiting for science to uncover their next secret life? What future breakthroughs are hiding in plain sight?